Hello, everyone. I'm Laurel Staples with NBC Montana. We're following a developing story out of Helena regarding a troubling report on St. Peter's Health involving allegations of sexual abuse. Montana Free Press reporters Mara Silvers and Jovan Wagner are covering this case and recently posted some new stories on this. And Mara joins me today via Zoom to walk us through it. And welcome, Mara. Thank you for doing this.
Thank you for having me.
All right, so this all began in the spring of 2024 with a complaint from a cancer patient. So tell me about that complaint.
So, what we know from the report that we've now read, this federal inspection, is that in April 2024, this 51-year-old cancer patient and her family told other staff members on the unit that she had been inappropriately touched by a male nurse on staff. What we know from the report is that even though that was talked about among other staff members on the unit, it was not formally documented in the hospital's centralized intake system for serious complaints like that. And we also read that in the next several months, the complaint was not elevated to high level staffers until January of 2025, in fact, so almost 9 months after the fact.
Wow. So this left other patients at risk, right?
Well, that's where we don't have as much information as we would like to, but we know that the person who was at the heart of that complaint, that male staffer, showed up again in a complaint several months later. There was another patient from 2023 who made a report in October of 2024, saying that he had inappropriately touched her, assaulted her when she was in the ICU. Now, what we're not sure of is what happened in those intervening 6 months between when this April complaint was made and when this nurse was eventually fired for a different complaint. Since our story came out, we have heard a little bit from St. Peter's Health about how they handled that complaint. And they said that their policy at the time was that they would not investigate a complaint unless a patient wanted them to,
Mm.
or unless a patient kind of continued to raise that complaint. So the CEO of St. Peter's Health has now more recently said that the oncology patient from April withdrew her complaint against that person, and so the hospital did not investigate it.
Okay. So where does this case now stand with this former nurse?
Well, the nurse in the complaint in this federal inspection is not named. None of the staff members are, but the details and the timeline about this one staff member line up with what we know from public documents, a criminal investigation and complaint against a nurse named Erin Gams, and also a licensing investigation into his conduct. He has pleaded not guilty to one criminal count, a felony charge of assault against a vulnerable adult, and he's expected to appear in court sometime this month in February.
Okay. And in your story, you also mentioned another nurse and a complaint, right?
Yes, so federal inspectors talked about another complaint from a different unit, the behavioral health unit, also in 2024, that involved a female nurse and a male patient. And that male patient filed a written grievance at the time that was also, again, widely circulated among staff members on the unit. But the federal investigators said that it was, again, not properly documented. The hospital says that they did investigate that case at some point. They won't be specific as to when. And they ultimately decided to terminate the traveling contract of the nurse who is mentioned there. We are, again, not sure of that nurse's identity, but the hospital said that it took immediate action when they became aware of that complaint and made sure that she was removed from patient care.
What happens now for the hospital? What are they doing to change things?
So the hospital was placed in what's called immediate jeopardy status by the Centers for Medicare and Medicaid Services. And that's basically a step towards losing the ability to bill public health insurance programs entirely, which is a pretty serious thing for a nonprofit hospital. But within a week of having that status placed on them in 2025, the hospital submitted a plan of correction and said that they were going to widely retrain many of their staff, all of of their staff members, almost 1,800 staff members at St. Peter's, and changed their documentation protocols for sexual assault and harassment complaints, which now they say they have done that. And an inspection in June of 2025, so about 6 months after the report was finalized, showed that the hospital is in compliance with federal regulations and their own internal policies.
All right. And I know there's probably so much more to this, probably trying to rebuild trust with the community, right?
That does seem to be what the administrators at St. Peter's Health are now focused on. They've said a couple of things publicly about this inspection for the first time and really pledged to do right by the community members in Helena that go to St. Peter's for their care. They've also said that the actions of a couple of staff members do not reflect the entire organization, and they've taken some accountability for the documentation errors that arose and were in place at the time this investigation was done.
Since this story's been posted, what kind of reaction are you getting?
Well, we've heard from a lot of community members who are just generally disturbed and confused and shocked at how this could have happened in the first place. A centralized reporting system for a facility of this size is important, of course, as you can imagine, to keep all kinds of complaints in a centralized place, to investigate them thoroughly. And the fact that there was communication about some of these allegations happening in various places doesn't, I think, give community members a lot of confidence about how the hospital is set up to protect patient rights and safety. Since the story has come out and since the hospital has started to respond, I think that we'll have to wait and see how community members kind of continue to ask questions about the hospital's protocols and what it will do differently going forward.
Do you anticipate some lawsuits? What are you hearing?
Well, of course, we are going to continue tracking the criminal charge against this former nurse, Erin Gams. Additionally, beyond that, we haven't seen or heard anything that indicates that other patients might come forward, but there is always a possibility of that, and sometimes that takes a while to lawsuits like that take a while to transfer from the private sphere into a public court system. So especially with malpractice or negligence or misconduct charges like that, we might not necessarily hear about those for quite a while, if ever. And that does make that kind of accountability a little hard to keep track of. But I think that this circumstance and these circumstances certainly had broad ripple effects and broad impacts across patients, even if there weren't more than 4 patients who were specifically referenced in this federal report. So there's a possibility that we could continue to hear from people who have concerns about their care in the last couple of years.
And I suspect that ripple effect also extends far beyond St. Peter's and the community, where does this send a message to other hospitals?
I would think that other hospitals could very easily find themselves in a situation where federal investigators show up on their doorstep and start to ask questions about their internal systems for things like this. That's a possibility for any hospital that's certified with the Centers for Medicare and Medicaid Services. It's a known entity and a very real part of being a nonprofit hospital. So it's possible, and I think that if there are other administrators who are following this story, they might be looking and to make sure that their protocols for documentation and investigation of serious complaints like this are airtight.
As part of your research, did you dive into some of the statistics on how often does this happen nationwide?
That is difficult to come by. That type of data is difficult to come by, in part because a lot of those internal reporting systems really do stay internal unless a patient decides to go forward with a very public complaint. And I guess what I would say about what we know about sexual assault and sexual harassment instances in general is that it can be very daunting and very intimidating to go public with that kind of a claim. So there are options for maybe to be anonymous in a criminal complaint, a Jane Doe or a John Doe or something like that, but it's still a lot to put oneself through. And I think in that way, we might not ever totally know the extent of an issue like this, whether at St. Peter's or at any other hospital.
Are there resources these folks can turn to?
That is a good question. The hospital in this situation has said that any patient who has concerns about past care could go to their official part of the website to file a complaint, a grievance, and they have an internal investigation process for that. But not every patient might feel comfortable doing that. And in that case, I would say that it's probably more likely that any number of nonprofits that help and support victims of sexual assault and abuse are a resource in a situation like that.
Well, I'm starting to wrap up here. Some of the big takeaways for you and what it was like for you to do this story.
Well, I would say that these types of reports from the Centers for Medicare and Medicaid Services are not uncommon to come by. There's every once in a while a report, they're public documents, and every once in a while there's a report that comes up about a healthcare institution or entity and how it's basically following those federal regulations for avoiding and protecting against patient abuse and neglect. And every time we read them and we try to make sense of them, it can be a little bit like decoding a puzzle. It's there. These are complicated things. Everybody in the complaint is anonymous. It's very difficult to map exactly how something happened inside of a facility. But it starts to give a glimpse just into really, especially for patients, how vulnerable many patients are when they're sick or they're seeking care someplace. And they do put a lot of faith in institutions to take good care of them, which of course hospitals and many other healthcare institutions say that is their mission. That's what they want to do. Sometimes that's easier said than done, especially at big institutions where there are many, many people interacting with patients every day.
All right. Well, anything else that you would like to share?
No, not at this time. Thank you.
All right. Well, a great article here, and we'll continue to follow this as it develops and check out your articles. Also, to those watching, you can read the full article at Montana Free Press and NBC Montana's homepages. Thank you, Mara.
Thank you so much.